I hope you can hear me well. Artificial intelligence in health from patient perspective. So this was what we agreed would be my part today. And so what we're going to talk about is really about what we as a patient organization have came up as a position paper. So the focus will be on the position paper and the work that we have done to arrive there. Um, Before I start with that part, maybe just a few words about the European Patients Forum for those who might not be familiar with it. So EPF is an independent, non-profit, non-governmental umbrella organization of patient organizations, and we work both across Europe and across disease areas. We have around 81 members, and we have disease-specific patient groups active at the EU level, but we also have national coalitions of patients who are not disease specific. So they include different patient organizations that are national. And our mission is to advance the interest of patients and patient communities by strengthening the collective impact through advocacy, education, empowerment, and partnership. And I hope I can touch on most of these things in our work on AI. So why do we work on digital? Well, it's been one of our strategic goals for the years 2021, 2026. So actually next year we are going to do a new strategic plan in which, of course, digital will still be quite high on the list. And what we try to do in this as a goal, let's say, is that we try to engage in all of the discussions regarding digital transformation of healthcare. And two things we really try to focus on is co-design, patient preferences, and then we also try to kind of do that with the view that we need to support a safe, high quality, more participatory, more patient-centered healthcare. So, which means that it's not that we are just, okay with the digital transformation just for the sake of the transformation, but it's really that for us it really has to also, bring this positive impact to healthcare professionals, patients, and the healthcare system in general. So we have, as you can see on the slide here, there are a few things that we have done in order to arrive to our position paper that was published in October 2023. So at the beginning, we had a survey for individual patients, and it was really just to assess briefly what was the individual patient perception on AI. And it was still the year where maybe we just started, ourselves at EPF learning about AI. So it was new for us as well. And so we just wanted to confront ourselves with what individual patients were thinking. So what their were worries, what there were hopes that AI, would do, but also just in general the perception that they had when there were these talks about using AI in healthcare. And then this has been followed by 2 reports on AI in healthcare from patient perspective and the EU policy and legislative framework. And then in 2023, we had a boot camp. So it was a meeting of high-level representatives of patient organizations, not only our members, but also members of members. And there we really tried to see if what we were writing, so our draft on this position paper, was aligned with what the heads of patient organizations were taking themselves. And so we try, to really measured it against all these things, and then we had the different trainers coming from different fields that also teach our members about, and their members of course, about risks, about benefits, and about also what Hannah was mentioning, so the AI Act in the um, all legislative area that surrounds AI and medical devices, for example, but also maybe the uses of AI in medicines development. So we really touched upon many things, and we followed this with a survey specifically for patient organizations. And then together with, of course, our EPF Digital Health Working Group, we came up with this paper on how to advance patient care through co-design and responsible implementation. So I have a few So let me just close this. So I have a few initial considerations about the survey. So indeed, conducted in spring 2023, we had almost 150 respondents. And as I said, our members are around 80, which means that we had almost double the number of the members that we have. This means that there are out there many, many more patient organizations who really want to work on this issue. And we were quite happy to see that, there are almost 150 organizations, not only in the EU, but in general, it's not outside Europe, but it was Europe. So we also included Balkans, for example. UK too. And indeed, there are really many of them who want to be more involved, who want to learn more. There are some other considerations, for example, that we translated it into many languages, and this was also the reason why we managed to reach to so many organizations. And then the majority of them were national patient organizations, but we also had 33% of patient organizations active at the EU level. I have then a few slides on some of the, let's say, responses that we had. And for example, this first one is about what they believed were the most interesting applications for AI in health. And we've got, as you can see, as the first point is the improvement of the accuracy of diagnosis. So the patient organizations really believe that this is one of those applications that AI can, play really a great role. And they also kind of a bit believe that there are different things that maybe AI can help us with in this case. And I believe it's quite a lot linked to the third point, so the supporting healthcare professionals in delivering more personalized care to patients. On the second point, we have the improvement of quality and efficiency of research and innovation in healthcare, so leading to better treatments. But here there is a caveat, and this is the leading to better treatments. So it was not just about the general improvement of research and innovation, but it was really about these and translating into better or cheaper treatments or more accessible treatments for patients across the EU. There's some other interesting points, such as the support to patient self-management and adherence, for example, to medicines and to other treatments, as well as the improvement of the organization of health institutions. For example, scheduling or fraud prevention, and also improving, for example, the prediction of health threats. But it was really quite low when compared to the diagnosis and personalized medicine and improvement of the research and innovation. On the next slide, it's what we asked is about barriers for effective patient advocacy in their experience. And the three main points here for them were lack of knowledge, lack of personnel or too much workload, and a lack of collaboration with other stakeholders. And so we try to go a bit deeper into that and to understand what they meant by lack of knowledge, and also about, of course, we understand what lack of personnel means, but we wanted to understand, how this impacted them. And some of the organizations have 3 to 5 people working there full time. So to just take one of those people's time to dedicate to something new and something maybe more complex, more technical, it was very difficult. So for them, this was really a very important point, and they hope that there would be more and more trainings and more possibilities for them to learn without having maybe to hire new people or to take a lot of their time that it's already dedicated to, I don't know, access to healthcare or IMR, many other topics. So it was something that was great to learn about and to work on, but they also didn't find maybe many opportunities that would allow them to do so without having to hire new people. And so we tried to do another question that was similar. So, of course, here we're asking what are the main barriers, but then also linked to it. So, what will help you better engage with AI in healthcare? And for the majority of them was knowing more on what applications exist for AI in healthcare. It's about knowing more what are the benefits and risks of using AI in healthcare, also knowing patients' rights and how to exercise them in case of the use of AI, having more funding, having more collaborations. And all of them indeed in the end are translated into more personnel, more funding, and more opportunities for engagement. We also wanted to understand what were their concerns. And here, as you can see, and we saw it in the previous presentation, bias was really the first point. So more than 50%, and I was actually surprised that it was not even more, that they believe that one of the biggest concerns and their fears were that AI can be biased because they use non-representative or not complete data, and maybe they overrepresent some groups underrepresent some others, as not just groups but also disease areas, genders, countries. So it was really all part of it, and this was the thing that really they feared the most. Another very interesting point here was that they feared the lack of involvement of patients in design of AI solutions. So we again try to understand a bit more what does it mean, because you can be, AI solutions can either directly or indirectly impact patients. So when it comes, for example, to the use of AI solutions in medicines, and medicine's development, maybe it was so much more indirect that then the involvement of patients maybe was not important, but then it becomes when we talk about clinical trials, so the use of them there rather than discovering the molecule. And then, for example, when it comes to medical devices or tools that patients could use at home that maybe have an AI component, this is very much where they want to be involved. They also talked about safety issues due to low quality and unvalidated AI systems, but at the EU level, that might not be something that would happen. And indeed, some of the things that we have seen on the slide are actually now have been kind of not resolved, but taken into account by the AI Act, and some of them are already part of the medical devices directives. So it's not that all of this can, that all none of this is already faced, but still there are some things that even if you fear something and you're concerned about something, you probably even maybe don't know that these things are out there, but it means that there is also not enough communication about what's out there and how we actually regulating AI. So we came up with some recommendations for ethical deployment of AI. One thing that I said at the beginning was about the digitalization, that so including AI, that we've seen that not as an end in itself, but rather as a means to mentally and physically healthier society, which leads to increased autonomy and empowerment of patients and more personalized and affordable healthcare. And then some of the recommendations that we had was do no harm. So respect for this principle and respect for human dignity with a high level of respect for human safety, for patient safety. And this is when we can link it to some examples such as the use of AI in clinical trials. On the second point, we have the addressing the data quality, so the bias and the integrity concerns. The engagement of patients and healthcare professionals, or those who are going to use the tools, and patients if they are impacted directly. Keeping humans in control of medical decisions, so it's really about autonomy and human oversight. Fostering responsibility and accountability, protecting patient health data and patient confidentiality. Ensuring safety by design, technical robustness, so also all the cybersecurity aspect of it is included here. The enhancement of transparency and communication. Here, it's both about this idea of AI as a black box, but it's also about being clear on what the rules are, how it is regulated, when it is used. So the many kind of types of transparency communication that are included in this aspect. And In the actual paper that I showed the picture before, you can actually find more about it, and these are only just bullet points. And then the last one is to prioritize education, training, and digital literacy for all actors included. So all of those that are part of the healthcare system. I have another slide. I think maybe I have a minute or two. And this is for any patient organizations or patients on the call. And these are about some opportunities for engagement. As a first point is if you ever get the chance to actually, talk with the developers, you can emphasize that you can offer valuable insights into the needs of patients via the lived experiences of the community that you represent, and so you can also identify where the gaps, what are actually these gaps that we want to work on, and for which we want to use the technology. And this is linked to offering advice on practical aspects of this technology, such as you can help them understand if it's usable enough, if it's user friendly, and how the uptake can actually be increased. You can also suggest, especially if you are a patient organization, that your community can be involved at the development stage. And so you can be part of advisory group, a focus group, and you can also test early versions of the technology. And all of this translates into this real life feedback that are very, very important. You can also offer guidance, especially as a patient organization, on training materials that are needed. And you can also offer to be a point of contact for developers. And a very last point, however, if you can offer this, but we also should not just consider ourselves as lucky, to be asked for advice or all of these insights. Insights are very valuable, and in the end, they're going to translate into product success. So if you help them, with making it, with improved usability or better explanations, this is going to make the product more successful. So it doesn't, we don't always, of course, there are some cases in which we cannot seek remuneration, and it's not even, maybe ethical, but there are some parts when we're talking, let's say, with the developers themselves, where this is actually appropriate and desirable. And yeah, I'm open for a few questions, and then I guess we can have a few also at the end of the presentations. And thanks a lot for listening.